We also have today Steve Haines, the Nursing Director of Critical Care Services at Ephraim Regional Medical Center in Danville. He's on via video, but you're going to hear a lot of the same things.
Haines. I'm a nurse here at Ephraim Regional Medical Center in Danville, Kentucky. I am the nursing director of the intensive care unit and the cardiovascular step-down unit. I'm also a respiratory therapist, and I've been here for 7 years. This latest surge we're going through in the pandemic, it's been pretty horrific. Last time, in the early surges of last winter, it kind of came on gradually. We got a lot of preparation and stories from friends that had worked in New York City, and you could see the virus coming across the country towards us, so we had time to be ready for it. This time, it was like the door opened and it just kicked it in. We were immediately overwhelmed. This last week, or actually last 2 weeks, has been, as I said, it's been pretty horrible with the way it's just come on. And unfortunately, people are passing away from this quickly. Over the weekend, we lost 8 patients within 24 hours. We only have like a 3-bed morgue at the hospital. So we actually overwhelmed what we have. And we were kind of frantically scrambling to try to rent a refrigerator truck to take care of these people. The funeral homes couldn't pick them up fast enough. And 95% of the people we're intubating have no vaccine. And some of these people look so disappointed or so angry. Just a whole sequela of emotions that come out of them. But they're scared and they're trying to mask what's going on because they just can't breathe. We put on their families on FaceTime. We let them have maybe their last conversation with their family member, and we put them on a ventilator. It's horrible because we'll start fixing somebody's lungs, and then they'll get attacked by clots, and they'll clot off every single artery in their body, and then they'll pass away that way. Or we have tons of strokes, and and then lots of pneumothoraxes. It's a horrible disease. We'll take somebody out, we'll take them to the morgue that we just can't save them, and there's somebody waiting 2 minutes later. And we get the housekeeping comes in, cleans the room, and we're putting somebody else in there, and it's a horrible rinse and repeat cycle. This lasts as long as the last surge that was 3 months, and we're only 3 or 4 weeks into this right now in my community. I don't know. I mean, we're going to do it, but it's going to take a monumental effort because it doesn't matter how many nurses or therapists or physicians or pharmacists or anything else we have. It's just not going to be enough. I really think we wouldn't have to work so hard to help our community if more people were vaccinated. And right now, it just looks like there's no end. And I think the only chance we have is vaccination. And that's it.
I want to thank him for his courage, for not only what he does every day, but willing to be that raw and authentic to show the trauma that they're going through. We think a lot, and we should, about that individual that we lose. We don't think a whole lot about the trauma of watching those people pass away, and just some of the things he said. They've overwhelmed their morgue. Funeral homes can't pick the people who've passed on away fast enough. They take someone down to the morgue and they have to fill their room in the next 2 minutes. Well, it's a powerful message to get vaccinated. It also shows you what these healthcare heroes are going through, and they need our support. They deserve our support.